Well, I had a little bug last week. Mark's under the weather today. A lot of folks dealing with, some kind of cold at this time of the year, battling something. City County Health actually declared flu season officially is here.
Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba, and I understand you're not feeling well either.
I'm not. I've got some sort of nasal congestion. I don't have influenza, but like everybody else, I am suffering. I'm suffering, so.
Have you seen many cases of the flu so far this year?
We've seen a few cases of influenza. The only way you can really tell if you have influenza is to actually get an influenza test, which means a swab taken, given a quick test, and it has to be done at, someplace like my clinic or a different clinic. And the treatment for influenza is not an antibiotic, but is the drug Tamiflu, and that shortens the course. And one of the issues about influenza is it tends to be worse than a cold. You tend to have a fever, you tend to have chills, you tend to feel just really uncomfortable. But once again, the only way to tell is actually to have a test and see if you have it, and we have been seeing some of it already.
I want to just touch on one other thing before we move on to the other topic. Is it ever too late to get a flu shot?
No, it's not too late to get a flu shot at all. And the flu shot, unfortunately, is not as effective as it has been in the past this year, because it turned out when influenza actually starts in South America and in Asia, the CDC decides exactly what strains they're going to use. They make a guess. Sometimes they're correct, and sometimes the influenza bug actually morphs out and is then different. And this year, it is different. So the influenza vaccine is only about 50 to 60% effective, but it still is effective enough to get the shot.
All right, well, let's move on to this topic we were talking about. Kids, sometimes web surfing too much is a bad thing, but for the elderly, we understand a new report suggesting if they're able to surf the web and do it frequently, it might be a good thing. What's that all about?
Absolutely. This was a study that looked at health literacy in adults, and health literacy is the ability to take in information and make a good decision about their health. And this was a 5,000-person study out of Great Britain that found out that seniors who surf the web do better in health literacy than seniors who do not. And I think it's because of that interactive issue. So I'm not recommending that seniors get on and play Angry Birds, but I am recommending that seniors get on and Google things that are of importance, play cards, and do other fun things.
Anything that keeps your mind active is beneficial.
Absolutely, absolutely.
All right, Dr. Zorba, you get well now, all right? You're around a lot of patients. I just got over mine, and you're probably seeing all kinds of sick patients in there, so you're...
You bet. I need chicken soup tonight. That's what I need.
All right,
that's the virus that everybody's getting. The gravelly voice and the respiratory.
Right.
It's the exact same thing that's going all around the newsroom here.
That's it.
Yeah.
All right, Dr. Zorba, be well. We'll say it to you
Thanks
this time.
a lot.
Good to see you.